What I want to show you now are the dermatomes. Now the dermatomes are the areas of the surface of the skin supplied by particular nerves. So let's have a look at the model of the vertebral column. So here we have the cervical vertebrae, that's the occipital bone of the skull, so that's C1 there. C2, 3, 4, 5, 6 and 7, they're the bones. Then the next we have the thoracic vertebrae, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Then we have the lumbar, 1, 2, 3, 4 and 5, L1 down to L5. Then there's 5 fused bones forming the sacral vertebrae and 4 fused bones forming the coccyx at the bottom, a total of 33 bones. But that's not particularly what we're interested in today. Today we're interested in the nerves. So as you know, there's the spinal cord in the back here. The spinal cord running down between the vertebrae. And coming off in pairs we have the spinal nerves. And the first 8 spinal nerves are the cervical spinal nerves. So we have C1, 2, 3, 4, 5, 6, 7 and 8. Now note there are 8 cervical nerves despite there being only 7 cervical vertebrae, because the first nerve is above C1. So they're the cervical nerves, C1, and of course it's C1 on both sides, C2, 3, 4, 5, 6, 7 and 8. Then the next group of spinal nerves are the thoracic spinal nerves, and we have thoracic nerves 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So 12 thoracic nerves, T1 down to T12. Then we have the lumbar nerves. So we have L1, 2, 3, 4 and L5 is just tucked under there. I think you can see that. And then there are also 5 sacral nerves. So here we have S1, that's S1 of course on that side, S2, S3, S4, and unfortunately this model doesn't have S5 on it, but it's just there like that, so that would be S5 where my pen is on both sides of course. And then to complete the 31 pairs of spinal nerves, again not on this model, there would be a coccygeal nerve, just one coccygeal nerve there. So they are the spinal nerves coming out from the spinal cord, supplying the motor and sensory nervous supply for particular parts of the body. And this next bit is where it gets very interesting. So this diagram shows the dermatomes, that is the surface parts of the skin, which receive their innervation from those particular spinal nerves that we looked at. Now the face is supplied by cranial nerves. There's 12 pairs of cranial nerves communicate directly with the brain. But then we see at the top of the neck that the innervation for that area is C2. And then the next one down, this area here, is C3. Then this area is going to be C4. Going down the arm, that area is C6. No, that's C5. C4 here. C5, C6. And then it goes on. Here we have T areas. So this area is supplied by T1, thoracic spinal nerve 1. Then this area by T2, T3, T4, T5, T6, 7, T8, It's like forming stripes around the body, isn't it? T9, T10, T11, T12. Then this goes down to the lumbar vertebrae. So here we have the lumbar nerves, rather, L1, L2, L3, nerve L3, L4, L5. And then some areas are supplied by the sacral nerve. So, for example, we see the penis is supplied by S2 and S3. And further down on the side of the foot here, supplied by S1. So that's the body looking at it from the surface. This beautiful arrangement of the spinal nerves, which are innervating all these particular slices and portions of the body. So if someone gets a pain in here, that's going to be an L3 pain. Tells you where the pathology is. If you get a pain in there, that's going to be a L2 pain. Or if you get a pain down there, that's going to be an L4 pain. Or indeed, if there's paralysis of particular nerves, again, this is where the paralysis will be manifest. So these cover sensory and motor innervations of these dermatomes. The dermatomes are the names given to these particular surface areas of the body. And here we see the view from the back. So C2, the nerves there go up from the C2 outflow to the top of the head. C2, C3 lower down, C4, C5, C6, C7 in the middle here, C8 just there. And then we see the thoracic dermatomes for T1, sorry, that's T2, T3, 4, T5, T6, T7, T8, T9, 10, 11, T12. And then here we're down into the lumbar, nerve L1, L2, going down there. L4's down here. We've missed out a couple of thoracic ones there, look. T1 and T2. And then further down we've got some sacral ones. So S5, S4, S3. This is S2. And the base of the foot, the plantar surface of the foot, is S1. So again, if there's pain in a particular area here, we know which nerve roots are affected because of the dermatomes representing the particular spinal nerves, the somatic dermatome distribution of specific spinal nerves.